Okay, so now let's see about wrist tendon anatomy. Okay, wrist tendon anatomy. I'll explain only the important things that I usually ask for MCQs. Okay, so the wrist tendon, extensor tendon, goes into different compartments. There are total of 6 extensor compartments. Okay, so let's see which are these 6 extensor compartment. So I'll draw the radius and the ulna. So this is the radius and the ulna, and okay, so this is the radius, this is the ulna, and this is the this is one important landmark, that is the Lister's tubercle. Okay, Lister's tubercle, or also known as dorsal radial tubercle or dorsal radial tubercle. Okay, so on either side of the Lister's tubercle there are 2 ligaments, and so the first ligament will be over here, not the ligament, these are the extensor compartment. The tendon will go inside the extensor compartment. Okay, tendon and extensor compartment. Okay, this is the first extensor compartment, then comes the next extensor compartment, second one, and 2 on the other side. One is over here, one is over here. Okay, then one is bridging the radius and the ulna. Okay, and the ulna has exclusively only one extensor compartment. Okay, so these are the 6 extensor compartment, and the tendons will be going within this extensor compartment. Okay, so this is the extensor. So now let's see which are the important tendon that are going through these extensor compartments. Okay, so you need to remember the first one, this first one, second one, third, and the last one. These are the important ones. Okay, so in the first one there is the APL and EPB, that is the adductor pollicis longus. Both are pollicis, so adductor pollicis longus and extensor pollicis brevis. Okay, and extensor pollicis brevis, and within the second extensor compartment there is ECRB and L. So this is extensor carpi radialis brevis and longus. Okay, so that is extensor carpi radialis brevis and longus. Okay, and the next one is the third extensor compartment, which is the EPL, extensor pollicis longus. Okay, and the last one is ECU, extensor carpi ulnaris, the 6th one. So these are the important ones that you need to remember. Okay, so now let's see some important associated clinical conditions. Okay, so tenosynovitis of some of these extensor tendon compartments are important. So the first extensor tendon compartment, there is something known as DQ veins. Tenosynovitis in the first extensor compartment. Then for the second one, there is intersection syndrome. Tenosynovitis associated with intersection syndrome. Then for the sixth one, there is rheumatoid arthritis tenosynovitis. Okay, in the early stages of rheumatoid arthritis, tenosynovitis can occur in the extensor pulmonaris, okay, of the sixth extensor compartment. And here there is, and the third one, for the third one, there is drummer's wrist tenosynovitis. Drummer's wrist tenosynovitis. Okay, so these are the important ones you need to remember, only these 4 ones. Okay, so now let's see each one of these in little bit of detail. So the first is DQ veins tenosynovitis. Okay, this is also called by the name of mommy wrist, mommy thumb actually. Mommy thumb or washerwoman's sprain. So here this intersection syndrome and DQ veins tenosynovitis are both under the category of tenosynovitis that occurs due to repetitive strain or occurs due to repetitive strain. Okay, so first one is DQ veins tenosynovitis and other name is mommy's thumb and washerwoman's sprain. So one test that is normally done for identifying the pain that is associated with DQ veins tenosynovitis is Finkelstein's test. Here in Finkelstein's test, passive ulnar deviation is done and there will be pain along the side of the along this side, that is along the side of the thumb, more proximally. Okay, so I'll show you where it will be exactly. So if this is the hand, means in DQ veins tenosynovitis the pain is classically in this area. Okay, and in the case of intersection syndrome, the pain will be over here. It will be more medially. Okay, so this is in the case of intersection syndrome. So in decurrent tenosynovitis, the other things are, what are the imaging findings? The imaging finding is that of tenosynovitis. What do you see in tenosynovitis? So on USG, you'll see, usually on any tenosynovitis, you see increased fluid. Okay, increased fluid within the extensor compartment. So here the fluid will be in the first extensor compartment, and on MRI the same thing appears as T2 signal intensity in the tendon sheath. That is affected. Okay, so that is what you will see or for decurrent tenosynovitis. Okay, and this for intersection syndrome, this usually occurs is seen in rowers due to repetitive rowing movement. Okay, and decurrent tenosynovitis is classically seen in young mothers who are holding their baby for a long time. Okay.